Perfect. Welcome, everyone. We are very, very excited to welcome you. My name is Gabriela Valdez, and I'm the Director of Global Education for the Global Health Institute. And we are very excited to welcome you here from the Global Health Institute in collaboration with the Global Health Programs and the Global Health Alliance. We're excited to welcome you to the Global Health Speaker Series, showcasing the multidisciplinary aspects of global health. And it is my pleasure today to introduce this month's speaker, Lisa Labita Woodson, who is joining us from Peru. Hi, Lisa. Lisa is a third-year PhD epidemiology candidate with a focus on global health. And she spent her last year as a Fulbright Fogarty Scholar carrying out research on the effects of COVID-19 on adolescent pregnancy and educational attainment in the Amazon basin of Peru. In the coming year, as a GHES Fellow, she will pivot her research to study the feasibility of implementing an adolescent sexual and reproductive health intervention in remote communities of the Peruvian Amazon, where she proposes to use the already established network of community health workers through the organizations Mamás del Río and peer educators as well. Lisa has an MPH from the University of Arizona and prior global experience in Nepal as both a Peace Corps volunteer and a Fulbright scholar. She has also worked in Thailand with Planned Parenthood International and in Senegal with Counterpart International and the University of Arizona. Within her home city of Tucson, she has worked as a teen advisor for Planned Parenthood, an infectious disease epidemiologist for the Pima County Health Department, an infection preventionist for a local hospital, and most recently as a food security research analyst for Tango International. Her future aims include creating career pathways for minority women in global health, and to continue advocating and promoting research that advances the rights of women, children, and other vulnerable populations, especially in low and middle income countries, to equitable access to care. We're very, very happy to have you here, Lisa. Welcome, and please, the floor is yours.
Thank you so much. Let me start my slideshow. Right here, start from the beginning. Thank you everybody for coming today. I see a lot of people in the room that I've worked with in the past, that are close friends, and some family members. Thank you all for coming. I really appreciate your support. Like Gabriela said, my name is Lisa Labita Woodson, and today I'm going to present on how COVID-19 affected the reproductive health and education of adolescents in the Amazon basin of Loreto, Peru. So here's a quick overview about what I'm going to discuss today. First, I want to talk about how I came about my global health research, how I did this research, what I found, what my next steps are, and leave you with some key takeaways. So just really briefly, I wanted to take you on a journey on my global health path. And I think Gabriela mentioned a lot of what I've already done, so I'll make this very brief. But I am a third-year PhD student. I do have an MPH in International Family and Child Health, and also undergraduate degrees in poetry and biology. And I've been working in global health for about 10 years now, a little over a decade. I first started as a Peace Corps volunteer in Nepal, and I think Clarissa's on this call. She was one of my fellow Peace Corps volunteers. I started as a science teacher, and it really was the start of my global health journey. And as a science teacher in a school in a rural part of Nepal, I got to experience the day-to-day struggles of my students. And I actually had a really unfortunate event at my school. One of my adolescent students had committed suicide as a result of an unplanned pregnancy. this motivated me to want to do something, and I wanted to prevent this from happening again. So I was looking at different ways of introducing sexual reproductive health and mental health within the school environment. But unfortunately, that didn't get to happen because I was evacuated from the country due to the ongoing civil war. I came back to Tucson and started my MPH. I then interned with Planned Parenthood of Southern Arizona and of Planned Parenthood International within Thailand, where I was first a teen advisor and then a researcher looking at HIV/AIDS within the Hmong Hill tribe population. I was then lucky enough to get my first Fulbright back to Nepal, where I studied child-to-child and child-to-mother health information exchanges within the household. I then worked briefly with the University of Arizona and Counterpart International in Senegal, doing food security and food aid research. I then was with Tango International, doing food security research. And then finally, right now, I am a Fulbright Fogarty Fellow in Peru. So why is this important and why did I give you this background? Because I have used these experiences to really develop a research proposal within global health. And I found it very helpful to base what I am currently doing on the experiences I've had in the past. And so I get a lot of questions about how I came up with my proposal. And I just wanted to give a quick list of just some key things and tips that I found really helpful. One of the first things is, of course, draw on your past experiences. Another one is select a country. Select a country that you're interested in studying in. I found that it was most helpful to select one that you've actually may have traveled in, worked in, have some experiences in. When applying for some grants, funders may want to know how well you understand the context within this country and how your research fits within the country. Also, choose a topic that you're interested in. I chose COVID at first, but know that if you're going to do global health work, you need to be flexible and that this might change, or what your research proposal, what it originally looked like, will change over time. Most importantly, do a literature review, but most importantly, get support. I am very lucky that I have the support of my U of A advisors, but also when I started my PhD at the University of Arizona, I sought out different people within the college whose research interested me. And luckily, I found somebody who was willing to email me back, first and foremost, but willing to mentor me and has been one of my strongest advocates. Also, find a host country affiliation and mentor. Here's Dr. Magali Blas with Mamas del Rio. I leaned on my contacts back at the U of A to really find an affiliation and a relationship, really build upon a relationship they already had. And it has been really helpful in my research. Also, do your homework. This is really, really important. To get different funding, you need to go ahead and do the research. Look at how competitive these grants are. Look what's been funded in the past. Look at where their affiliations currently are, what affiliations they're hoping to establish. Do research, look at the different types of reports they've done. Different reports or host country affiliation has published, or even your mentor. Have a real good understanding of what you're asking before you go ahead and ask these host country affiliations to help mentor you. And know that in global health, everything changes very quickly and you may have to adapt idea. And this is really important because you should ask yourself, not only is this research important, but how is this going to be useful and helpful for the population or the participants in which I'm working with within my host country? I get a lot of questions also about funding. So this last year has been funded through 4 different sources. I first got a Fulbright Fogarty Fellowship in Public Health to Peru, and that kind of catapulted a lot of different funding opportunities for me from that moment forward. I learned very quickly that the budget I had with the Fulbright Fogarty may not be sufficient enough to cover the cost of transportation, translation, and a research assistant, all very expensive. So luckily, the U of A has a lot of resources through the Dean's Fund and also the U of A Graduate Professional Student Council. Then this next year, I am leaning, I did get a second grant to do more research within my study sites through the Global Health Equity Scholarship Program. So now that we've gotten all that out of the way, this is my research proposal. I want to know how COVID affected the reproductive health and education of adolescents. My host country affiliations are University Peruana Cayetano Heredia and their program, Mamas del Rio. My host country mentor is Dr. Magali Blas, who is also the director and founder of Mamas del Rio. My study sites are within the rural communities in Loreto, which is it's the department northeast of Peru within the Amazon. My hypothesis is that prolonged school closures due to COVID will increase school dropout and adolescent pregnancy. And my research consisted of a secondary data analysis, a qualitative study, and an intervention feasibility study. So why did I choose this site? There's a lot of reasons. As everybody can recall, Peru had one of the highest case fatality rates in the world during COVID. If you don't remember what case fatality rate is, it is the number of deaths over the number of people who have the disease over a time period. And so the cumulative rate as of October 2022 for the world hovers about 1%. Peru has a cumulative rate at 5.2%. And within the district of, sorry, can you guys see that? And within the district of Loreto, which is based in the Amazon, that rate was 7%. And during some of the COVID peaks, that rate went up to 15%. Also, Peru was very unique in the way that they try to mitigate the spread of the disease. They had some of the strictest and the earliest mitigation efforts. They had quarantine starting almost immediately. I think March 16th was the start of almost a 2-year closure of schools, 2 years quarantine of the entire country. So these 2 years when the schools were closed, I was interested to see what the effect was going to be, because as we already know, prolonged school closures, a lot of them from past research in Ebola and also in disaster areas, have shown that they have higher risk of adolescent pregnancy. Also, students are less likely to enroll back into school, and adolescent girls are at higher risk of exploitation, child marriage, and gender-based violence. So Loreto has not only had one of the highest case fatality rates during COVID, it also has the highest rate of adolescent pregnancy of girls 15 to 19 years of age. Their rate is at 32%, whereas the national rate is at 12.5%. They also have a high rate of infant mortality, a high rate of poverty, and many of the communities lack access to healthcare. About 30% only have access to healthcare. So how did I do my research? Really quickly, I'm going to talk about my qualitative research. I'm going to hold off talking about my quantitative research and my feasibility research. I will present some of that results, but I won't talk about it in detail here because I think most people were interested in how I collected the data. So I had 11 study sites along the Marañón River. The Marañón River is within Loreto. All the communities are only accessible by boat. So I turned first about 230 kilometers of river to get to all my study sites. And I had started collecting data in June of 2022. I utilized referral sampling with agentes de comentarios de salud, or community health workers, the APUs, or the tribal leaders, and community obstetricians within local health posts. In total, I had 41 semi-structured interviews, and I also use a multimodal approach where I use drawings and ask adolescent participants to draw their future aspirations. In total, I had 11 pregnant adolescents, 9 never pregnant adolescents, 9 adolescent boys, and 12 community leaders. To develop my interview questions, I used the Bronfenbrenner's ecological systems model as presented here. This model views child development as a product of mutual interactions between the child and various complex layers of 5 nested environments. These include the micro, the meso, the eco, the macro, and the chrono or time. And I was interested in how COVID affected each of these ecosystems and in turn had an effect on the sexual reproductive health of adolescents and also their education within the Peruvian Amazon. This is just a really quick sample of the themes that I explored in my qualitative research across the different ecosystems. On the far side, the green side, we have the macro system, and it goes all the way down to the individual on the right-hand side. So in the macro, we were interested in social and cultural expectation and barriers to education and sexual reproductive health, whereas on the individual side, I was interested in asking about empowerment and their attitudes towards education, pregnancy, contraceptive use, and maternity. So before I dive into what I found, I kind of want to take a moment to talk about different ways to collect and present data, because this is something that I have been exploring within my own research. And I wanted to take a moment just to talk to you as researchers to think about ways, not only how we collect the data and analyze it, but how we present it to different audiences and for different purposes. So I am a trained epidemiologist and data analyst. I am most comfortable working with numbers and statistics. So I did use quantitative data. I did a secondary data analysis to explore the relationship between adolescent pregnancy and school closures. And there's different ways you can show this data through graphs and tables. And in today's presentation, I have a short graph that we'll explore in detail. Then you can also collect data qualitatively. These can include interviews and focus group discussions. What it really does is has an in-depth understanding of the research through summarization, categorization, and interpretation of words and meanings. And from that, we can pull out important quotes and develop our understanding or the context with different themes. You can also use a multimodal approach like photo voice, where it's a participatory methodology where participants take photos and share their experiences through photo, or in my case, I use drawings. And lastly, you could have an arts-based approach. And today we'll talk about how poetry can be used in some of our data. So this is some of my results. My quantitative results, like I said, I did a secondary data analysis. I use NDES data. It's similar to the demographic health survey data, and NDES stands for the Encuesta Demografía y de Salud Familiar, where I compared the 2019 pre-COVID data to 2020, 21, and when 2022 data comes out that year also. And I think this is really telling about what's going on here. And I think what I'd like you to look at in particular is that here on this, we see that by, in the year 2020, dropout declines. We also see that adolescent pregnancy also declines. And we also see that contraceptive use goes, well, that kind of declines. It's kind of hard to say, but here we see that age of sexual initiation also declines all around 2020. And some would say, oh, great, our data looks good. We're doing great things in Peru. But as we see in 2021, some of those levels, like dropout level, kind of stays stagnant, but we see that we have an increase in we see increases in, adolescent pregnancy right here. And we also see some other changes. And it's hard to explain. So what's going on in these communities? And really, I think the qualitative data helps explain this in more detail. And so with my semi-structured interviews, we collected a lot of quotes. This is my favorite, and I'll just read it real quickly. My mom always tells my sister, you have a lot of mirrors. You see the mistakes of your classmates. You have a mirror. You have friends who have children. You see how they suffer, and do you want that? So using the data collected from the semi-structured interviews, we created this diagram from a thematic analysis. On the left-hand side, you'll notice the impacts of COVID-19. They consist of economic impacts, education impacts, and the impact of access to healthcare or clinics, which was almost non-existent during this time period. And on the other side, you'll see the social norms as dictated by the community, religion, and parents. And the red line, if you can see that, the red lines here, they're directional. When they're solid red lines, they're directional, and it's a negative directional relationship. With the black solid lines are positive directional relationships. Anything that doesn't have an arrow or dotted is either red is negative and black is positive, but they're non-directional. And really what you'll notice here that there are different factors that influence not only adolescent pregnancy, but early marriage or early unions, dropout, and decreased contraceptive use. In this next section, we'll just briefly go through some of these themes that we collected from our data. So during COVID, rural communities only accessible by boat within Nauta and Parinari were restricted in their movements, and ports had to be closed to mitigate the spread of the disease. Everyone had followed strict social distancing measures, yet despite their efforts, as one adolescent points out, in the end, we all ended up getting the disease. There was limited access to health at the posts, and they're largely understaffed or without any staff. Many participants instead used medicinal medicine and prayer. Some participants gave accounts of family and community members dying. And a lot of the adolescents expressed feelings of fear, loneliness, sadness, and boredom. Economically, many households lost their livelihoods during this time period as fishing was their main income generating activity. Thus, many adolescents were forced to seek work outside of the community, and many of them ended up in very exploitative situations. Also, there was an increase in subsistence activities where many of the adolescents went out into the chapuras or fields to collect food or to grow food for their families during this time. As mentioned before, schools were closed nationwide for 2 years. During that time, the government issued tablets to be distributed to rural communities to facilitate online education, and they delivered monthly photocopies of handouts. However, these efforts were largely ineffective due to lack of internet connection, lack of electricity, and the cost of recharging their data plans on the tablets and the cost of the photocopies were not affordable for many of these households, which had to be covered by the parents. Also, many students abandoned school, and I don't say drop out, they abandoned school. And there's a distinct difference here because many of them stopped attending classes overall or completing their homework, but they remained registered at the school within their communities. And in 2020 and 2021, the Peruvian government determined that students would pass the year. So even if they hadn't met their academic proficiencies, had attended school, or even done their homework, they all passed. During this time period, instead of attending school, students went to work. And the only people who officially did drop out in my study were pregnant adolescents. Everybody else had abandoned school, but were still registered within the school system. Here we're going to talk about social norms really quickly. I want to read this quote to you, and I hear this quite often actually, which is surprising. If you see the majority here, the men are older and the women are young, and they jokingly say that they want fresh meat. That is what they tell you. It's the jargon you hear, which is still maintained here in the jungle. So within these communities, girls become adults at an early age, usually defined around puberty or menstruation, about 12 years of age. It is also assumed that once they start puberty, that they will also begin their sexual relations at this time period. Boys, on the other hand, are defined as adults at a little bit slightly older age. It's defined usually around their ability to perform physically demanding tasks within their communities. Many young girls have relationships with older men. They're typically 10 to 15 years older than them. And when girls become pregnant, a union is sought even if it is against the will of the girl. There are also cases where pregnant girls are abandoned by their partners, and this usually occurred among outsiders from the community in which a union could not be forced. Young girls may also choose to escape with their partner if the parents do not approve of the relationship, and upon becoming pregnant, will force the parents to accept the union. Additionally, young girls have less decision-making power in these, especially within these relationships with older men and over their contraceptive use and family planning. And parents exhibit a lot of control over their adolescent girls. So the age range for girls to become pregnant in these communities is about 13 to 17 years of age, whereas boys become fathers much older. Within adulthood, it is very rare to see an adolescent father within these communities. The perception around adolescent pregnancy is that these young girls suffer due to the economic problems associated with the inability to financially care for a baby, especially when their partners abandon them. For those who are never pregnant, it signified an end to their social life, also an end of their education and an end of their future aspirations. And others expressed that it was part of their culture, that it was preferred to have children young because you had energy and you had the ability to care for them better. When asked about causes of adolescent pregnancy, some said it was because it was the instinct of the girls to become pregnant, that they were promiscuous. Others said it was because parents lacked the control of their children. And lastly, many believe that young girls became pregnant to secure a partner, especially a partner that had economic means and security. And this quote I liked also, the 17-year-old male participant had said, being a mother at an early age is not good because it harms your mental health, your education, your studies. When you have a child, you have to be aware of him. You can no longer follow your dreams after finishing high school. In this part, I do ask that you feel free to I'll ask you a question and you kind of make some educated guesses, but these are drawings grouped by participants. And I kind of want you to look at them and see what you see. Tell me what you notice. I think it's really important because it's telling. I think it points to how they see their futures. And so let's start by this one. Looking at this one, can everybody see that? So in this slide, who do you think do these images? And we have adolescent boys, never pregnant girls, and pregnant adolescent girls. This one's pretty easy. Can anybody guess? I'll let you know. It's adolescent boys. So what I really want you to notice here, one participant drew not working in the jungle, but working in Cusco, where Machu Picchu is, as a tour guide. Others wanted to be engineers, police officers, investigators, doctors. What I want you to really focus on here is that young boys can envision a future or profession both within their community and one outside of their community. And they can envision a future in fields that they have not seen within their communities. Here, I'll just let you know, these are adolescent girls who were never pregnant. And what I want you to notice here, that similar to the boys, they can envision a future outside of their communities. They can envision a future outside of what they see. So the only professions that these young girls really are exposed to are obstetricians, nurses, medical technical people, and then also teachers. But here we see some that drew wanting to be an engineer. Two actually wanted to be an engineer. One wanted to be a chef in Iquitos, which is the capital of Loreto. So, and then other ones wanted to be obstetricians and work within schools. Lastly, these are adolescent girls who are pregnant. And these girls could not envision a future or could not aspire or envision their futures being anything outside of what they know within their own communities. And so we see here teachers and obstetricians, nurses, but they couldn't envision something that they had never been exposed to. And then one thing I found really interesting that was missing in all these photos is that not one of them had Drew wanting to be a parent or a mother. In this next section, we'll look at an arts-based approach to convey my participants' lived experiences. So you might be asking, what is an arts-based approach and what does it do? How does it relate to research? Well, it's a discipline that not only blends in art, but it brings in scientific inquiry. It articulates the rich contextual realities of participant lives that are meaningful and emotive. We can reanalyze the qualitative data and present the analysis in a way that's accessible and consumable. And also, this is not a new idea. It's been gaining traction over the last 2 decades. If you were to do a quick search on the internet, you'll see that even the JAMA Network has a journal just dedicated to poetry and medicine. And also we have the Health Promotion Practice Journal. I really like this link here. It's to the WHO article, which they use poetry to increase COVID vaccination among groups of people. And I thought it was really interesting how we can use poetry and arts-based approach to really talk to the complexities of our data. I think this next section, can we stop recording just for a moment? So this next step is kind of where I envision what I'm going to do in this next year with all this data. The first thing is, of course, share my findings. What I found in the communities is, I am not the first researcher to come through, but they were really upset by the fact that past researchers never shared their data. They never came back to talk to them one-on-one about what was found.
Hello, everyone. I think we might have lost our presenter. Give me just 1 second. While we wait for, oh, here.
I'm so sorry. I don't know what happened. Yeah. Yay. Let me go back to share screen. I think I left off with this slide. Can you hear me?
Yes.
Can you see the slide? Okay.
Yes.
So basically, I want to share my findings. I want to go back to these communities and share it with the agentes or the community health workers, also with the local health posts, the tribal leaders. I think it's important to kind of not only reach back out to them, but to share what I found. Other organizations we're interested in speaking with and sharing our findings are Indigenous organizations within these communities, government agencies, including HARESA or Red Nauta in the Ministry of Health, and then organizations such as Care Peru, PROMSEX, UNFPA, and Association CAIPA. So I'm also in the process of developing an intervention with my study sites that address adolescent pregnancy, adolescent sexual reproductive health, using an already established network of community health workers and getting feedback from different stakeholders. And so this is kind of the model we have been presenting across different stakeholders and getting feedback on it. And we're hoping to do this intervention that not only uses the agentes, but also uses junior agentes or secondary school students or adolescents to help promote sexual reproductive health messaging to their peers, and also to make contraceptives more accessible within these communities. So what is an intervention feasibility study? Well, there's many different areas to focus on, and the areas I chose to focus on were acceptability. Is adolescent-led sexual reproductive health promotion acceptable in these communities? The demand for it, can this intervention be done within Nauta and Parinari, and what are the barriers to this implementation? What resources are available to carry out the intervention, and can the agentes or the community health workers carry out this intervention with Mamas del Rio, and in what capacity? So this will be done through focus group discussions with stakeholders and through interviews. If you're really interested to learn more about this next step, we did develop a story map that outlines every detail of the intervention, the different types of theories it's based on. And we're using this to really promote it to our stakeholders within Peru. And hopefully it'll be in Spanish soon, but right now it's only in English. So what are my key takeaways? I want to start by reading this quote because I think it really speaks to how I've been using my data. Data are just summaries of thousands of stories. Tell a few of those stories to help make the data meaningful. So I've used different research methodologies and visualizations because I wanted to give a more comprehensive understanding of the complexity of these adolescent lives within the Amazon basin. And also I wanted to empower my participants by giving them a voice and allowing them to tell their stories. And in the end, I think what this arts-based approach really does too is elicit cognitive empathy from our readers. I challenge you to share your results in different ways, in meaningful ways across different stakeholders. And this can help you get buy-in and support from different levels, including the community level, organization, or even within the government. People are interested in seeing data in different ways. And also, it's been helpful using this type of approach in presenting it not only to these stakeholders, but as a tool to help formulate my next step, my intervention. And in the end, I think what the key takeaway for me is that it's imperative that we work now to counteract the effects of COVID on adolescent girls in the Amazon basin who are most vulnerable. And I think we're in a very unique position, having done this research right after schools reopened, to really implement a sexual reproductive health intervention to hopefully reduce teen pregnancy within Loreto. Really quickly, I do want to have a shout out to all the important people in my life that have made it really important or have made it possible for me to do this research. Not only my family, who has been through it all with me, but also Magali Blas, the director of Mamas del Rio, and my mentors at the University of Arizona also, Dr. Brown and Dr. Maria Banan, and also to all my different funders, the Global Health Equity Scholars, the College of Public Health, the Graduate and Professional Student Council, and also the Fulbright. And also a special shout out to Adriana, who is my research assistant, that without her, I don't know if I would have been able to do this research. So any questions? That was kind of quick. So we have about 10 minutes for questions, 8 minutes for questions.
Okay, I'll go first.
Hi, Clarissa.
Hi, Lisa. This was amazing. First of all, super stoked about the variability in the methodology that you used. Really interested in that, like those qualitative pieces in terms of the drawing and poetry. So look for a follow-up email from me. But also, I'm just curious, like, how would you recommend implementing those types of methodologies in not a research setting, so in more of a programmatic, I'm thinking program evaluation setting where you're doing data collection regularly, you know, every 6 months, every year, something like that. Like, do you think that they would come across competitive or repetitive, or how would you recommend doing that?
Very good question. I actually had to ask, there's a researcher who specializes in drawings as a qualitative tool out of Greece. And he was so kind to actually respond to my emails. I send lots of emails and begging people to answer all these questions I have. And he actually gave me a lot of direction because I wasn't quite sure how to approach it. I'd never even heard of it before. And I read it in a book and I was like, wow, I want to do this. I want to be able to allow the adolescents an opportunity to express themselves. And he actually was the one who helped me kind of, in the short meeting we had, to rethink how I was going to do this. So I'm not an expert in it. I'm not quite sure how to integrate it in that type of situation, but I did find it was very helpful and it could be very meaningful. It really depends on your audience too, because not everybody wanted to draw, but there were some adolescents that loved it. It was amazing. I brought every type of art thing you can imagine into the field, and they got to choose whatever they wanted, and they had a ball. They thought it was great. And the question was not something that they didn't feel like they couldn't answer. So I felt like it was very empowering for them. And it was also really helpful for me to see when I compared the drawings, what I was looking at and make comparisons in that way. As for poetry, there are different methodologies to use qualitative data. So if you're collecting data that's qualitative, taking out key phrases, taking out key themes, and adding it into your poem is one of the ways that you can do it. But there's a whole methodology behind it, which is something that I'm blindly stumbling into, but have really enjoyed the journey.
Thank you so much.
Lisa, I have a question. I was wondering if maybe you can speak a little bit more about establishing a rapport or a relationship with the communities, and how did you do that, and how key was Mamás del Rio to establishing this partnership and relationship with the communities that you engage with?
I wouldn't be able to do anything, absolutely nothing, without the support of Mamás del Rio. It was and Magli Blas, who is my mentor and the director of Mamás del Rio. The Agentes gave me access to the communities because they trusted Magli and they trusted Magli's work. They in turn trusted me. I also had a research assistant. I interviewed 40 different people, and I had to find somebody who could be relatable, somebody who could be engaging, and somebody who can gain trust and rapport really quickly. That is not an easy skill to look for in interviews, but I was very lucky to find that person. And so I had certain things working for me. Not only did I have the trust of the Agentes, who not only invited me into the communities, who were willing to introduce me to the tribal leaders. And from there, once I gained the trust of the tribal leaders, after I explained my research, then, only then, would I be allowed to interview the adolescents or people within the community. I avoid going to any community that did not have an Agente, and I did not do anything within these communities without the explicit permission of the APU. If you do not get their buy-in, if you do not get their permission, it can be pretty dangerous, and it doesn't speak well to the organization, Mamás del Rio, or even to your own research. So it was important. We had to build a lot of connections, and we did a lot of talking before we could even talk to our participants. But I find it's been nice going back into the field because people remember you and they're like, hey, Lisa, how are you? What are you doing? So it's nice. So this last time has been really great, just reconnecting with some of the agentes, but also the community members. So it's been a really rewarding experience.
Hi, all. I don't have a question. I work with Lisa, but I just want to congratulate you for the magnificent work that Lisa does. One of the qualities of Lisa, I will say that she's really concerned about the people with whom she worked. And I will highlight that quality that it's not easy to get a researcher. So I just want to say congratulations, and I'm happy for all the work and all the help that you are providing us, because in Mamas There Go, we had this need of a study adolescent pregnancy. We were only working with young women who were mothers, but not with how to avoid that they are mothers, and how to avoid adolescent pregnancy, how to work with that. So many thanks for that.
Maybe. Any other questions?
Well, if we don't have any other questions, I just want to really thank you, Lisa, for this great presentation. It was great to learn about this. And also thank you everyone who had the time to join us for this. Also save the date for the next session that we have scheduled for December 8th at noon for our next Global Health Speaker Series. Thank you again. And thank you everyone for joining us. We will be posting this recording in our website, and we will be sharing this with everyone else. Have a great day, everyone. Thank you, Lisa.